Welcome to another episode of season 3 of Dr. G at the Heart of Healthcare. Today, we are talking to Dr. Stuart, founder of Partner for Care, an innovative platform for hospice agencies. Welcome to the show.
Thank you very much for having me.
Yes, I'm so happy you're here. You have a pretty impressive background, a New Yorker, and a gastroenterologist through internal medicine, palliative care and hospice, masters of science. What is this professional study of narrative medicine? That's interesting.
It's that's a whole nother, almost could be a whole separate podcast. It's a wonderful, actually growing discipline that was started at Columbia University, utilizing um, literature, art to inform how healthcare professionals, physicians listen to and care for patients, and it's basically and increasing the ability to listen carefully, and that listening carefully allows physicians to better understand the story of illness, and see patients not as their disease, but as experience of their disease, which is their illness. And it's actually increasingly taught in medical schools for fourth-year students. And it's a wonderful program. I did the certificate course over about a year and a half, and there was actually a master's in it as well. Highly recommended. It's really a wonderful experience.
Yeah, thank you for sharing. Well, that's why you got to come back to ACP too. We have some sessions on narrative medicine. Those are always the great ones at the
Yeah.
annual conference. And we did a podcast during season 2 with a group that does oh my gosh, I'm drawing a blank, but it's like they listen to you and then they act it out. I forgot what it's called. It's
Oh,
something
interesting.
I can't think it's going to come to me. I'm so sorry. But anyway, very interesting stuff that keeps us balanced. So let's talk about this thing you invented, audience. So I actually used to work with Dr. Stuart in the Bay Area of California, and he works for a large hospice agency in Northern California. And he's actually beta testing this wonderful platform you're going to learn about today, Partner for Care. It's empowering caregivers, and it's something that's very innovative that is going to, from the demo that I saw in Denver, it's going to really empower the caregivers to be able to navigate symptoms and everything they're doing as they take care of their family members on hospice care. And so let's just jump into it. So tell us how you ended up creating this platform, and just give us the whole story about it.
So briefly, my journey, as you kind of mentioned, how my long history as gastroenterologist for many years, and then got involved with hospice initially on a personal basis. My dad was in hospice about 8 years ago. Took care of him at home. It went well, but despite all my experience as a physician and a good relationship with my father, I realized there was still a lot of things I didn't understand and didn't know how to manage. And that was kind of perplexing to me a little bit. I just thought it was not that it was going to be easy from a personal, emotional point of view, but I thought the process itself of taking care of my dad was going to be easier than it was given my background as a physician. So that was kind of surprising to me. On the heels of that, actually, the small local hospice that I was working with kind of somewhat urgently needed a medical director, and I knew the owner, and my wife did as well, she's a physician in addition. And I kind of took that opportunity, started to get involved with hospice in that fashion. Don't have to talk too much about that. That led me to the master's and getting further education in hospice. But specifically with regard to Partner for Care, that was the first step in understanding or having a feeling that there was a need for better information. Shortly after that, two very good friends, two separate groups of friends, had loved ones in hospice, and speaking with them because again they're friends, and they were talking about that things they didn't understand how to do, they didn't have resources for, um, things that I thought even were that they were not unsophisticated medically. I thought that they would have some understanding of how to do that. So that was another sort of piece of the puzzle of something is missing in this big arena. Um, and I started to, well, look at the information hospices give us. Let me look at the packet that they give us and the pamphlet that we all know about who are involved with hospices. And I looked at that and asked my friends, did you look at the stuff the hospice gave you? And I said, well, yeah, not really useful. It's just packing information, a lot of legal stuff in there. And where's the stuff, easy access to information that I want? So that led me to think, well, there must be something out there. There must be an app or a website that is a one-stop resource for caregivers. And the more I looked and the more I investigated, there wasn't. There's a fair amount of apps for dementia care, interestingly. Maybe not surprisingly, given the burden of dementia care. So there's a lot of mobile apps and websites for patients who are taking care of dementia patients and what to expect and how to manage some of the issues. But the more I looked, there was no one-stop resource for specifically topics related to hospice care. So that was the first sort of growing sense that there was a need and there was a gap in resources.
Yeah, I mean, if I can say something, that says a lot as a physician through internal medicine. We pride ourselves on knowing all this stuff, and when the tables are turned as a caregiver, there's a different ball game. There's a different set of skills that need to be navigated, and we're all familiar. You and I, since we work in hospice care, the agencies will have a binder that they leave with families. Some have, good marketing materials or brochures and things like that, but not necessarily handy. And when people are taking care of someone on hospice, there's just a lot to navigate, and also the other issue of people coming on at the last minute. There's not much time to navigate things, and so they need something that's handy that can help them. So tell us how they'll be able to use this platform, because I'll tell you, everyone, this is going to be personalized for each hospice agency. So tell us more about that, how they can sign up or how they will use it, and then how it will help the caregivers.
Yeah, so the site is designed for really for a resource for hospices. I mean, so you can think about it for both the hospices and the caregiver. Ultimately, the customer, as it were, or the reason the partner of care exists is to empower and enable caregivers. But we know that caregivers and the patients, it's a unit of care. The caregivers are fundamental to the care we give as hospice physicians for the patient admitted to hospice. So it's a unit of care, as we know. If caregivers feel prepared, they provide better support. And when the caregivers provide better support, hospices do a better job of fulfilling our mission to take the best care we can at people's end of life. So the hospices, this is designed to make the caregiver's life as easy as possible at every step of the way. So I didn't want caregivers to have to figure out how to log in, sign in, find the site. So it's designed for the hospices to provide partner for care at time of admission of the patient. So hospices have unlimited access to partner for care through a subscription model. And they just simply sign up the patient when the patient gets admitted, and the caregiver gets a link, and all they have to do is put the link in and put their cell number in as the password, and then they get logged in until the patient is no longer in hospice. So as far as the caregiver is concerned, at the time of admission, the intake person's coming out, the nurse, the doctor, they're getting the information, they're getting onboarded, and then should be immediately they get a link to part of their care that's welcoming them from the specific hospice. So ABC Hospice is providing this resource for you, part of the care, to help you in your role. And the caregiver, again, just clicks on the link, puts a cell number in, and then they have full access to the content of the site.
That sounds fantastic. Now, while you were giving me that on the spot demo in Denver at the Academy. We were at the Academy, everyone, the yearly annual conference of the American Academy of Hospice and Palliative Medicine. We did the HAPC 25 recap, but that's where I saw it. So, what are some of the things that people are going to be able to learn from the website or be empowered by?
Great. First, I would mention how it's presented, which I think is really an important part. A big part of for the partner for care is how the information is presented and how easy and accessible it is. I think I'll answer the question in a moment, but we'll kind of give the prelim for this. We know that it's really hard to understand complex information, even simple information, when things are emotionally charged and people are under distress and duress from patient coming into hospice and being at home and in their new role. So a big part of partner for care is the concept behind it, and the development of it was to present the information in as easily accessible and understandable format as possible. So it's an infographic form mostly. So the information that I'll discuss in terms of the big groups of topics is not go to a page and read tons of words. It's really an infographic form. And we can talk about the concept behind that. There's actually a fair amount of literature about the benefits of infographics versus text. So everything I'm about to mention is mostly in infographic form rather than just going to and reading words and words and words. It's not a supplement for a pamphlet. So it's organized in 7 main topics. So when the caregiver opens up the site, there's 7 tiles, and the infographic. So there's sort of a design to it and nice little icons. And it's broken up into symptoms, medication, when to call the nurse, first week in hospice, what to expect with dying, and dementia. And there's also a glossary that's searchable. So there's a glossary that has pretty much every term that a caregiver might come across, either in the site they don't understand, or that someone from hospice is talking about, and even some of the the legal part of hospice. Medicare and all beneficiary and all that stuff. That's all defined and searchable within a glossary. So within the symptom, there's a tile of the symptoms. You click on the symptoms, and then there's another page that covers all the main symptoms that we have to deal with.
Could you list
And
them? Could you list them for the audience?
the
Yeah.
symptoms are, that's good. The symptoms are respiratory, shortness of breath, bowel issues, constipation, diarrhea, pain. Oh, now you're challenging me. It's been a while since
No, it's good for people to hear, because
Yeah.
in hospice care, while you're looking that up, we are focused on comfort. It's not, your people always are afraid of the H word, right? And so we want you all to know that we focus on how the person feels and palliating their symptoms. And so that's how we're guided, how they're looking, how they're feeling, and how can we bring that back to an optimal place, where whatever their goals of care are. So that's why I just wanted to mention that, not to put you on the spot.
Well, actually, I realize there's actually a lot of the main symptoms. This is guided I think you're bringing that up because it's guided from exactly what we know as hospice physicians that we routinely have to discuss with patients and the issues that routinely come up. It's a good spot to point out that there's nothing that is sort of new or complicated within the site. It's really doubling down on what we as hospice physicians and nurses and everyone going out to the patient's home or the skilled facilities have to deal with on a regular basis. So it's the big topics of pain, anxiety, restlessness, shortness of breath, bowel problems, nausea, vomiting, appetite and food, urinary problems, sleep, belching and hiccups, skin care and mouth care. Those are the basic. And you click on those topics, and it'll give you further information about what to expect, why it's happening, what the caregiver can do about it, what medications are available, and when to call the nurse. Each of those symptoms are broken down in those within the infographic of quickly look at, okay, why is this happening? What can I do? When should I call the hospice? And that's in every page is pretty much laid out in that format.
That's excellent. And I heard you also say something about the first week of hospice. You and I know that the median length of stay is just about 17, 18 days, under 3 weeks, because people don't take advantage of the 6-month benefit as much as they should. So that first week is very, important to get everyone settled. So what kind of things are covered in that first week section? I'm just curious about that.
So the first week is the first one is what to expect. So I think a big thing, as we know, is what the expectations, what hospice is and what it isn't. It's not always, it's not someone coming out every day and helping feed and bathe the patient every day. It's not having to go to the toilet every day. So it's what to expect from hospice, is what hospice is charged to provide, what it isn't necessarily charged to provide, and what the team is, and what the team does. So the other thing in first week in hospice is supplies you may need. There's a nice, just simple things like bedside thing, fan, some extra, some hand sanitizer and baby wipes and cans. And this was actually informed by one of the friends who actually has a Down syndrome kid, is very medically sophisticated, but when the mother was in hospice, it was like I didn't have all the, other than the durable medical equipment, there was this sort of common sense stuff that I didn't think to provide in the room. So there's that listed as well. And then the other topic in the first week in hospice is topics to discuss with the hospice team. Treatment preferences, links to advanced directive and post forms, things to discuss about beliefs and values, things that are informed by what hospice, again, is charged to do that we don't always think of having the patients and families discuss. Religious beliefs, what do you want to have available to you as far as chaplains and the like, and what support you need as far as spiritual religious issues go. Something that's not necessarily touched on, but is part of what we need to do. And that's that's one other topic as well.
That's fantastic. So I think, I see there's a video here on the website that people can click on to kind of look at the demo and see how this is going to be so wonderful for the industry. Any challenges you're seeing as you're beta testing this with the agency in California?
Yeah, so I think that you touched on the, and this is something I thought about and wondered how it was going to play out with regard to the length of time the patients get admitted. So the median length of stay is 18, 19 days. The mean length of stay is quite long because there's about dementia patients. And one thing that I become aware of is that when patients get admitted and are in hospice only for sometimes 24, 48, 72 hours, as we know, is there enough time for this to be useful? And if it's not useful, is there a way to be more useful? So I think what I'm trying to exploring and understanding is what the sweet spot is for this kind of information. And if it doesn't meet everyone's needs, it's probably not going to meet everyone's needs all the time. But if it's not meeting the needs of people who are admitted to hospice for a short period of time, is there a more effective way of providing services that the caregivers need within the short time that they're a caregiver? I think the reality is that, we know that some patients they come from the hospital, they just want to die at home. And I just had a patient that we admitted them. I think they were alive for 8 to 12 hours, but family thought that he would have probably comfortably died in the hospital, but they said we don't think he's going because he wants to be at home. Brought him home and he was passed in 12 hours. So I think we've all had experiences with those very short lengths of stay. It's not probably ever going to fit any need that's necessary for that. They just need emotional support. They don't need medical information. So I think that's over time I'll understand how to have a breadth of information that's useful for short and long term. Um, I think the way it's at the moment, I think it has been showing that it's good for patients who are there for a good few days, and especially because there's some sites about first week in hospice, what to expect, when to call the nurse. There's a whole section of there of what things you should call the nurse for instead of revoking and calling 911. So I think that'll be an interesting evolution of the site in terms of experiencing what all those unanticipated needs are.
Excellent, excellent. So, audience, we have so many hospice agencies in California. So there are, a lot of folks that can test this out. Would you say this is something that would be more useful for a larger agency, or could small agencies also benefit from using this platform for their, as I would say an adjunct to their website, or to be better, to be more engaged with their patients and families?
Yeah, I think that my view of this, it should be good for every size hospice, and perhaps fill different needs. I think for some small hospices, it might actually be something that they're not able to do. My goal of this has not been to say I'm doing something that you can't do or don't want to do. This is all an adjunct and augment what we're trying to do as providers, to provide as much information as we can. I think small hospices perhaps struggle with that, and this could be something that, use this. We need to use it to give the information to the caregivers. Other hospices may say, I think we're doing a pretty good job with this. And we don't really think that they perhaps would think that they don't need this augmented information or this way of presenting it. We could talk at length. A big part of me developing this was investigating quite deeply into where hospices are doing less well than they would probably like to do, and for CAP studies, online reviews, and surveys. That if there's one universal theme, no matter how you look at it, by yourself or even fairly robust studies have looked at, where hospices percentage-wise do less well is caregiver support with information, what to expect. And again, it's not because we don't try, it's just a really hard thing to do. So if I was talking to a large hospice, says, our online reviews are great, our CAP scores are 5 out of 5, I would still say that those caregivers still need some information, because even if your scores are great, if you delve in and dive in, you would probably still have caregivers that don't feel fully supported. And if the majority of them do, and there's some that are not, that still has significant consequences
Mhm.
to the care we're trying to give to the patient. The
Mhm.
reality is that it's a really hard thing to do, to provide the information adequately and that patient caregivers retain. And this is just augments that and helps either significantly or just improves what you're already doing fairly well. So that's
Yeah. That's fantastic. I think it's great. Everyone learns in different ways, and for those, high energy, high touch. I don't like to call people high maintenance, but for those caregivers who want to be engaged, who want to do more, who want to have that high level of excellence, I think they're going to love this. And there's so many Facebook communities. I'm involved in one with about 20,000 folks, and they just ask basic questions on there. And I always wonder, I'm so sad for them. Like, do they not feel connected to their RN case manager? Is their team not available? It's just, it doesn't make sense to me because I know the level of engagement that my hospice teams work. So it's just always surprising. So thank you for creating this.
Right.
Not like you don't have a lot of things to do already as a gastroenterologist, a hospice physician, everything you're doing. But kudos to Partners for Care, an empowering platform for caregivers that can be personalized by hospice agencies nationally to engage with the caregivers. And sounds like it can help with revocations and all those high anxiety things where people really don't know how to navigate home care.
Yeah, the other thing we didn't touch on, which that the revocation part is sort of a think about this as a three-leg stool. One is the most important is caregiver support, caregiver satisfaction. Just on a one of our main goals. The actual hard numbers of caregiver satisfaction can have ramifications for individual hospices. The other thing we didn't talk about is improved workflow and workload on the nurses. If the caregivers have access to information, they don't have to call the hospice number and or get a text from all stuff that hopefully can be answered, I believe can be answered for part of the care. So decreased workload and work demand for the nurses and physicians within the hospice, I think is a tangible benefit. And then the third is can potentially decrease revocation rates. I think that's somewhat, that was a minor goal of part of the care, but the first one, caregiver supporting empowerment, and then helping hospices tangibly with improved workflow is certainly something that hospices, I think, can benefit from.
Fantastic. Well, we need that. So with your platform and all the developments happening with the EMRs utilizing AI and just, making our time be used wisely instead of death by clicks with documentation, I
Yeah.
think we're going to have a better healthcare system. And so thank you for what you've done to invest in this, and we look forward to growth. All right.
Well, thank you so much for having me on and allowing me to talk about my passion.
All right. Well, thanks for being here. Signing out. Season 3. Peace.